Hi, I'm Dr. Michael Blaha from Johns Hopkins Hospital, representing the first committee here at the SCCT meetings in Montreal. And I'm here with Dr. Matthew Budoff from UCLA to talk a little about the role of imaging in prevention, which is one of the main topics here at the meeting. So thanks for joining us, Matt. And I had quite a couple quick questions. We just heard Valentin Fuster talk about the important role of prevention in the next decade, really, of cardiovascular medicine and the role that imaging will play, particularly atherosclerosis imaging. First of all, what did you think of Dr. Valentin Fuster's talk?
Well, I think, Valentin always gives an incredible talk, and I think it's inspiring. He's so well-traveled and understands the implications not only here in the United States, but really throughout the world. And I think it's great to have that global perspective when we think about these diseases that are now increasing in third world countries while somewhat decreasing in our own countries.
So that's a good point you bring up. But what do you see as the role of imaging, particularly cardiac CT, in third world countries or emerging countries where the atherosclerosis epidemic is coming?
Yeah, and I've always been a fan of selective imaging anyway, rather than imaging everybody, trying to get at the people who are at risk. And I think it really helps focus the provider, it helps focus the patient, and it helps provide medications that might be in short supply. So if we can identify, let's say, even among the diabetics in these third world countries, which ones have significant atherosclerosis, we could provision things like statins a little bit more effectively where they're not as readily available as they are here in the States.
And of course, with coronary calcium scoring, just about anyone can do this study on any CT scanner around the world, wouldn't you say?
Yeah, and it's widely available. You need a 4-slice scanner, which I'm confident that even in almost every third world country now, there's a number of these that can be done. And because it's a 5-minute test with no prep, it can be readily done in rapid succession. In Thailand, I know they do something like 80 of them a day on one scanner, just in an 8-hour day. So you can get a lot of people through the machine and really allocate resources effectively that way.
Yeah. So great points. And I think one of the messages of this meeting is we're really, as a medical society, we really need to merge prevention in with imaging and show that our imaging actually improves outcomes. And I think that's really the next step, showing that our tests, if we appropriately use them, can actually change outcomes and influence behavior. So what do you think is next for us to show that paradigm shift towards imaging?
Well, I think we have great data now with compliance, and I think obviously that's the next natural place where we're going to see improved adherence and compliance with the patients that are going to really lend itself dramatically to better care. It's hard to necessarily show sometimes that a calcium score may make you live longer because there's a lot of intermediate steps there, right? It's not that clear what dose of statin you use. Should you use a statin? Should you put them on aspirin? We have I think we need more randomized trials just showing which treatments are efficacious. And I think once we know that, I think the next step would be obvious.
So once again, thank you, Dr. Matt Budoff, for joining us here at the SCCT and talking to us more about prevention and imaging. And please join us on youtube.com/firstinimaging for more blogs direct live from the SCCT here in Montreal.